Our other top story tonight, today's coronavirus numbers, and they are not good. 610 new cases today. That's 156 more than yesterday and the highest single day count in 7 weeks. Along with that, the state says 10 more people lost their lives to COVID-19.
Now take a look at this graph from clickondetroit.com showing cases and deaths by age range. You can see the bar on the far right shows seniors 80 and older make up 43% of COVID-19 deaths in our state, far and away the highest. You can check out more data like this right on our homepage, clickondetroit.com.
A website that tracks the risk of COVID-19 spreading in each state has changed Michigan's status from being in control of the spread to at risk for active outbreak.
Take a look at it right here. Dr. Frank McGeorge is here to talk about what's changed in Michigan and which parts of the state are now at greatest risk. Hey, Doc.
Hey, Kim and Jason. Yeah, first, it's really important to understand that although the state reports the number of new positive tests every day, and it has been going up consistently, there is much more nuance to interpreting those numbers in the context of whether there's ongoing community transmission. The website COVID Act Now uses a number of different factors to calculate a risk for COVID-19 worsening in any given state. For Michigan, they've flagged our infection rate as high. That basically means, based on their calculations, any infected person will infect more than one other person. That's important because it tells us there is likely to be continued infection without something changing. Now, the website also flagged Michigan for suboptimal contact tracing. By their calculations, Michigan is currently only able to trace 48% of the new COVID infections within 2 days. Now, the state itself, in partnership with the University of Michigan, also analyzes the risk level. You can see that since mid-May and into June, the overall risk had fallen, particularly up north. But by the end of June, the Lansing and Grand Rapids areas became concerning. And as of the calculations done on July 4th, the risk level for every region has gone up, with particular concern for the Grand Rapids and Lansing areas, now both at high risk, and the Detroit area increasing to medium risk. Now finally, looking at the big picture of cases in the state graphed by date of onset, you can see that the increase in cases actually goes as far back as June 22nd, when people who have tested positive reported their symptoms began. So the bottom line here is that all the data from different sources is pointing to a steady increase in COVID-19 in Michigan, particularly in the west side of the state and the Lansing area. But the numbers in our area are also concerning, and without correction, the increases will likely only increase faster. Back to you.